Hello everyone, welcome to the new session of our podcast Learn Together is Better Than Learn Alone. Today we are here in this edition to talk about diabetes. This is one of the most common metabolic diseases occurring in childhood here in Mexico and over the world. That's the reason why we must emphasize in this condition. In this podcast we are going to make an analysis of the main aspects that involves type 1 diabetes mellitus. So, my name is Víctor, and today I am here with Nathaly, Yoara, and Francisco. And to start with the topics, I would like to hear you talk something related with the definition of diabetes.
November 14 is World Diabetes Day, so it is important that we understand about this currently prevalent disease. In this episode of podcast, we will focus on type 1 diabetes. Type 1 diabetes, also known as autoimmune diabetes, is a chronic disease characterized by insulin deficiency due to pancreatic beta cells loss and leads to hyperglycemia. Although the age of symptomatic onset is usually during childhood or adolescence, symptoms can sometimes develop much later.
Okay, and talking about epidemiology, Francisco, what can you tell us about it?
Talking about epidemiology worldwide, of all diagnosed diabetes cases, only 5 to 7% correspond to type 1 diabetes. In the case of Mexico, by 2020 it was estimated that there were more than 70 million people with some type of diabetes, both diagnosed and undiagnosed cases. However, type 1 diabetes only represents 1% of the total. It is thought that this disease is autoimmune, so in reality it's not very clear what all the risk factors involved could be, so it's not considered a preventable condition. It's only known that a family history of this disease increases the risk of type 1 diabetes. As Nathaly said before, another relevant fact is that most patients are diagnosed at early age, such as in childhood and adolescence. Even earlier, this type of diabetes was called juvenile diabetes. However, patients in adult ages have also been recorded.
I want to tell you something about the causes and pathogenesis, and to talk about pathophysiology, make us remember that type 1 diabetes mellitus is an autoimmune disorder in which systems destroy tiny portions of the pancreatic tissue. This is obviously the organ which produces the insulin hormone. And basically, this is a genetic disease, but at least this is not hereditary. So, those people who develop type 1 diabetes mellitus have a gene mutation that causes the antibodies. And the activity of this kind of antibodies is practically destroy beta cells which produce insulin. Some antibodies are related or associated with another kind of activities. But about the diabetes symptoms, Yoara, can you explain us something about it?
Well, the following symptoms of diabetes are typical. However, some people with diabetes have symptoms so mild they go unnoticed. Common symptoms of diabetes are urinating often, feeling very thirsty, feeling very hungry even though you're eating, extreme fatigue, blurry vision, cuts or bruises that are slow to heal, weight loss even though you're eating more. Sometimes occur when a viral illness. In some cases, a person may reach the point of diabetes ketoacidosis, TKA, before a type 1 diagnosis is made. TKA occurs when the blood glucose is dangerously high and the body can get nutrients into the cells because of the absence of insulin. The body then breaks down muscle and fat for energy, causing accumulation of ketones in the blood and urine. Symptoms of TKA include a fruity odor on the breath, heavy, taxed breathing, and vomiting. If left untreated, TKA can result in stupor, unconsciousness, and even death.
And another topic that is important to remember is about the diagnosis. So, Nathaly, what can you tell us about this topic?
In most young people, the diagnosis of type 1 diabetes should be made without difficulty and on a urgent basis. Symptoms of excessive thirst, fluid intake, and urination should prompt immediate anti-insulin antibody testing. Other test results can be intense glycosuria, possible ketonuria, and random hyperglycemia of 200 mg per deciliters. Repeating random tests should be done to determine glycemia and glucosuria, also make a determination of autoantibody makers in islet cells. Other important test is glycated hemoglobin, which is higher of 6.5. In young people, type 1 diabetes usually begins suddenly and acutely with polyuria, polydipsia, and evidence of ketosis. In a minority of young people, the onset is slower, with symptoms appearing over several months. Additional clinical data are new onset or persistent enuresis, abdominal pain with or without vomiting, vaginal candidiasis, little weight gain or weight loss, fatigue, irritability, impaired academic performance, and recurrent skin infections.
And about the treatment, Francisco, can you tell us something easy to remember?
Regarding treatment, insulin must be administered daily due to the absence of this hormone. Insulin can be administered by subcutaneous injection using very fine singulars or by pen-like applicators. There is also another device, an insulin pump that is similar in size to a cell phone, which is placed on the skin of the abdomen and releases insulin with a probe. The advantage of this device is that it is programmable to automatically administer insulin. In addition, they must have support from a nutrition expert to control the amount of carbohydrates they should eat and, based on their sensitivity to insulin, determine specifically what amount of insulin should be administered before each meal. Also, they must do active moderate physical fitness and maintain a stable IDA weight to avoid other complications of diabetes such as heart disease. There is also an experimental treatment where a transplant is performed at the level of the pancreas of the islets of Langerhans so that the patients can produce insulin and does not longer need it externally.
And finally, Yoara, I want to hear you summarizing the importance of this disease, please.
In resume, type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition. This condition, the pancreas makes little or no insulin. The insulin is a hormone the body produces to allow sugar or glucose to enter the cells to produce energy. Different factors such as genetics and some virus may cause diabetes type 1. This appears during the childhood or adolescence. It can be low in adults. Even after a lot of research, type 1 diabetes has no cure. The treatment is directed toward margining the amount of sugar in the blood using insulin, diet, and lifestyles to prevent complications. It's important to know this pathology because there is no way to prevent diabetes type 1. Researchers are working to prevent the disease or further damage of the islet cells in people who are newly diagnosed. But also you can live a normal life. Stay healthy if you control of diabetes. Only you have the power to control it.
Alright guys, thank you to everyone. I want to say one last thing. At the end of this podcast, we had the opportunity to emphasize in the importance of type 1 diabetes mellitus. It's important to remember that even our understanding of the etiology and pathogenesis, it's not completely standardized. We made a great establishment of the causes of this condition that makes us remember and understand the disease. All in all, we hope you enjoyed this podcast with this valuable information because remember, learn together is better than learn alone. So thank you guys, see you next time.